We will discuss the prostate cancer part 27, and it is the last part of the prostate cancer. Prostate specific antigen, the PSA. The PSA, a glycoprotein in the calcarine family, is produced by prostate epithelial cells and deposited in the seminal fluid. A PSA acts as a serine protease and cleaves the seminoglin, a protein in the seminal vesicles. So it will lead to cleaves seminoglin, a protein in the seminal vesicles. Cleavage of seminoglin reduces the semen viscosity. That means it causes semen liquefaction and lead to greater sperm motility. So this is the main function of the PSA, act as a serine protease and cleaves the seminoglin or seminoglin. Seminoglin. This seminoglin is a protein. Seminoglin is a protein in the seminal fluids. Cleavage of the seminoglin reduces the semen viscosity, and this causes the semen liquefaction and lead to great sperm motility. The mechanism by which PSA enters the systemic circulation is unknown. The PSA blood test measures the concentration of the PSA in the circulation. In addition, circulation, the total PSA equal the free PSA plus complex PSA. This is the total PSA. The complex PSA is bound to the protein, mostly to anti-chymotrypsin with smaller amount of A1 or alpha-1 anti-chymotrypsin with a smaller amount bound to the alpha-2 macroglobulin, where the free PSA is not bound to other protein. So it is the complex bound to alpha-1 anti-chymotrypsin and a small amount mostly to the alpha-1 anti-chymotrypsin and mostly to this, and a small amount to alpha-2 macroglobulin. The PSA half-life is approximately 2.2 to 3.2 days. The PSA does not vary during the day, no variance with circadian rhythm. PSA is androgen dependent. It is produced or production is stimulated by androgen. Condition that can alter the PSA level. The condition that can elevate the total PSA: prostate cancer, benign prostatic enlargement, infections such as prostatitis, bacterial cystitis. Antibiotic treatment will cause the PSA to decline in the nearly 30% of men with chronic prostatitis. Prostate manipulation or trauma within the past several days, specifically cystoscopy, urethral catheterization, prostate massage, and prostate biopsy, and bicycling prostate exam without excessive prostate pressure does not alert the PSA appreciably. Ejaculation within few days before the test may increase the PSA level. The PSA increases with age. Condition that can reduce the total PSA. 5-alpha reductase inhibitor, finasteride, dotasteride, typically reduce the total PSA by approximately 50% after 6 to 12 months of the treatment. Also, the maximum PSA reduction and the time to reach it's highly variable. So it is 50% with finasteride, dotasteride, 6 months to 12 months of treatment. This medication usually do not alter the percent free BSA. It's usually alter the total BSA. Okay, so reduce the total BSA, not the free BSA. Using 5-alpha reductase inhibitor appear to improve the ability of the BSA to predict the presence of the prostate cancer, particularly high-grade cancer. So the 5-alpha reductase inhibitors improve the ability of the BSA to predict the presence of the cancer, high-grade one. Men whose PSA does not decline by 50% with 12 months after starting the 5-alpha reductase inhibitors, or whose PSA raise while on 5-alpha reductase inhibitor have a high risk of prostate cancer. Therefore, prostate biopsy is often recommended in this men. Okay, that the men does not decline by 50% within 12 months after starting the 5-alpha reductase inhibitors, or whose PSA raise while on 5-alpha reductase inhibitors have high risk of prostate cancer. Low serum testosterone, example hypogonadism, testosterone lowering medication like ketoconazole, luteinizing hormone agonist, anti-androgen, this lead to decrease the PSA. Prostatic surgery, for a surgery that remove or destroy part of the prostate, PSA might rise immediately after surgery because of the prostate manipulation, but with longer follow-up, the PSA usually decline. Prostate radiation often elevate the PSA during and immediately after the radiation. However, with longer follow-up, the PSA usually decline. Hemodialysis and peritoneal dialysis do not alter the total PSA, but they do alter the free PSA. Therefore, the free PSA should not be used in a dialysis patient. There are several different PSA assays. The PSA can vary by up to 25% between different assays. This PSA value from different assays are not interchangeable. There is no reliable conversion factor between assays. BBH and PSA. In men with BBH, a high PSA increases the risk of prostate growth, deterioration of urinary symptoms, low urine flow rates, acute urinary retention, surgery for BBH, and BBH progression. In men with BBH, serum PSA is proportional to the prostate volume. Thus, men with larger prostate tend to have higher PSA. Prostate cancer and PSA. Using the PSA to screen for prostate, risk of prostate cancer based on the PSA, prostate cancer and pre-treatment PSA, prostate cancer and post-treatment PSA. PSA kinetics. The PSA doubling time versus PSA velocity. PSA velocity is based on the assumption that the PSA increase in linear fissions, and it can be calculated using a simple formula. This is the PSA velocity. As you see, equal 0.5 times PSA and the second PSA minus first PSA per time 1. That's the year from the PSA 1 to PSA 2 plus PSA 3 minus PSA 2 per time year of from PSA 2 to PSA 3. So this is the PSA velocity. And all this, the calculation time 0.5. The PSA doubling time is the number of months take for PSA to double. PSA doubling time is based on the assumption that the PSA increase in an exponential fashion. The calculation of the PSA doubling time is complex and usually requires sophisticated computer algorithms. At least 3 PSA values are required to calculate PSA kinetic. The PSA value must be far enough apart in time to reflect the meaningful change. Example, at least 3 months apart when the PSA kinetic are used for prostate cancer screening, and at least 1 month apart when they used for advanced prostate cancer. PSA kinetic calculation may be more reliable when using a greater number of PSA value. A short PSA doubling time and high PSA velocity are indicated of poor prognosis. PSA doubling time in men with biochemical relapse after curative therapy, local recurrence is more likely when the PSA doubling time long, that means more than 1 year, whereas the systemic recurrence is more likely when the PSA doubling time is short, less than. So systemic recurrence when the PSA doubling time is less than 6 months, and when the PSA is long, more than 1 year, that's the local recurrence is more likely. So local recurrence when the PSA doubling time is more than 1 year, and systemic recurrence when the PSA doubling time is less than 6 months. In men with biochemical recurrence after curative therapy, M0 is raising PSA or the metastatic M1, PSA less than 3 months at any time before or after castration associated with high risk of death from prostate cancer. So that means M1 when it is less than 3 months. Okay, this is the men with biochemical recurrence after curative therapy. M0 with raising PSA or with metastatic disease less than 3 months, that is associated with high risk of death from prostate cancer. Prognosis improve as the PSA doubling time increase. PSA velocity can be used for prostate cancer screening. Men with pre-treatment PSA velocity more than 2 nanogram per year curative therapy are more likely to have higher grade tumor, high T stage, and lymph nodes metastasis. They are also more likely to recur and more likely to die from prostate cancer. This is the end of prostate cancer. Thank you very much.